Okay, let's talk about this issue that I've been ignoring for several weeks. Ready? We've been talking about what's been going on in the UK on and off for a while. Particularly, we've been really watching the situation with puberty blockers, right? Like puberty pausing medication. This is normal. It's normally dispensed for children with precocious puberty. And like precocious puberty, I think technically is puberty before the age of 8. Like that's the health concerns of, increased all-cause mortality and stuff. That happens typically at very young ages. So if a kid is like 9 years old and they're starting puberty, technically I think that is safe for them, but it is disruptive to them socially. So typically, like the most common use of puberty blockers is for children who are starting puberty a little early and they and their parents want to delay their puberty until they can develop alongside all of their peers. So you might start puberty blockers at age 8 or 9 and take them until your age like 12 or 13. And then you just resume puberty. When you stop the medication, your body's normal process of doing hormones and everything, it just starts normally, right? There's no significant adverse effects that we can see from that. So there has been like an increased contentious issue around like trans people being able to access this medication in order to prevent unwanted effects. Basically, if you are a trans girl, if you're a little girl who's trans, you probably don't want to have a really deep voice, and you probably don't want to be 6 feet tall. I mean, some women like that, but maybe you don't want to be 6 feet tall. And so you want to start this medication in order to avoid those effects. And it can also give you some time to address like the underlying whatever, like, is there some other issue? We have a lot of trained medical professionals who go into this, who look at like, does this kid really, really, really need this medicine? And even with the way that things go, it's only the kids that are rigorously like vetted who get this medicine in the first place, And this is not even to say, I think that in the UK, it's been like you can get puberty blockers, but you cannot start cross-sex hormones until age 16. So you basically just have to be in limbo of no puberty, not developing alongside your peers, and you only get to start when you are 16. Like, I'm personally of the opinion that we should let trans kids develop normally alongside their peers, just like cis kids who get to have puberty blockers for precocious puberty, Like, if you have a kid who is trans at a young age, and they start puberty blockers at age 11 or 12, and then they get to be 14 or 15, and they still are identifying as trans, it's been years at that point, you should go ahead and like let them develop alongside their peers. But in the UK, they have been restricting this gradually. We've been watching this, they've been saying, oh, you can only get puberty blockers if you are in a clinical trial. And then they most recently, like the most recent thing that I've covered at least, is they said if you started getting these from a private clinic, like if you started getting them from some, a approved medical provider who just isn't on the National Healthcare Service, they were like, yeah, but we need you to stop taking those so that we can do wellness checks, or like so that we can determine whether it's okay. Like initiating a potential legal process that is obviously very damaging. So now the Tory government, before they left, basically just said, we're banning puberty blockers, period, for trans kids. Still going to give them to cis kids, but banning them. And it's not like, oh, they're banning puberty blockers, but you can still get cross-sex hormones. Nope. Just like you don't get to even, I don't even think that you get to start on the wait list for this type of care until you're an adult. And like if you try to get it privately by shipping the medication in overseas or by going to Gender GP or another private clinic, that might actually cause them to do an investigation, like a child protective services kind of investigation, which is very, very invasive. It's huge government overreach, and it makes it functionally illegal. Like the parents could be penalized and the kids could potentially be taken away. So Wes Streeting is like the new labor leader. The labor government, which is supposed to be like functionally the left-wing government, it's like roughly the equivalent of the Democrats in the United States. He has said puberty blockers a thread. We're not going to read his whole thread. But children's healthcare must always be led by evidence. Medicine given to children must always be proven safe and effective first. I know there's lots of fear and anxiety. Let me explain why this decision was taken. So they're claiming that trans people having puberty blockers is not evidence-based medical care. Based on the CAS review, which we have already talked about on this channel, and which says the advisory group for CAS report will not contain subject matter experts. So they did not include any actual experts on the subject matter in the advisory group, as its role is focused on the governance of the review process. Additionally, it said that the advisory group will be independent of NHS England and of providers of gender dysphoria services and of any organization or association that could reasonably be regarded as having a significant interest in the outcome of the process of review. But they did let known anti-trans collaborators on the advisory review group. You know, apparently being explicitly anti-trans doesn't make you biased or have a significant interest in the outcome of the process of review. And like, if they work for the NHS, it's not like they're making a ton of money off of this care anyway. They're just NHS employees, you know? Oh, of course, Labour is not considered left by UK standards, right? Of course, like it's the equivalent of the Democratic Party. They're not left-leaning. So they did not have any actual experts on the subject matter. They did not have, like, they did such a, like, they did a very big cherry pick where they were like, okay, this we've decided is evidence and this we've decided is not evidence. And they discluded basically any evidence that suggested that puberty blockers were good for kids. They just decided that it was not evidence-based care. And obviously this is egregious on its own. But the thing that I have been procrastinating talking about this for is the fact that a number of trans youth, since the Bell decision, which was in 2020, there have been a huge increase in deaths of young trans people on the NHS waiting list, and NHS management has sought to suppress that evidence. So, you know, I want to make sure that I want to create messaging that tells young people your life is not over if you don't have access to this care, right? And like, you will grow up, you will be an adult, you will get access to that care, you can do it, you can make it. When you're a teenager, though, all of this stuff feels very intense, and your brain is like literally physically incapable of imagining longer term versus short term outcomes. It's like the experiment. If you give a little kid a marshmallow and you say, okay, little Timmy, if you can just wait 10 minutes, I'll give you 2 marshmallows. But if you eat this one marshmallow, you will not get another marshmallow. Like, a little kid will eat the first marshmallow because their brain is not capable of understanding a greater reward in the future, right? And this is also true of teenagers. So like, despite the fact that I would like for these teenagers to believe that things will get better, you can't deny that like there are things they're experiencing that they can't unexperience. Like young trans boys growing boobs. They will have to have a surgery to remove them, and they will be most likely subject to the NHS wait lists to be able to access the body that they could have had if they had just been given the goddamn puberty blockers in the first place, right? Like, I don't want to downplay. There are things that, like, there are harms being done to these young people that are very easily avoided. Like, that's the whole thing about puberty blocking medication, is it avoids these things that are like either very difficult to reverse or are actually irreversible. You know, like that trans women have to have facial reconstructive surgery that they would not have had to have otherwise. You know, like there's this claim that, oh, they want trans people hooked and paying a bunch of money to big pharma for the rest of their lives, they are actually going to have to pay way more to big pharma if they have to get tens of thousands of dollars of surgery instead of just being able to transition at a young age and not have this, what many people consider like a disfigurement happening to them. Hi, I'm Alexander and this is Mitternacht. You should hit the like button and subscribe and check out the Patreon. And ooh, look at this hoodie I'm wearing. It's merch. Check it out. Links in the description. Thank you. So Joe Mom, he's the director of the Good Law Project, King's Counsel. Like, he's a lawyer, I'm pretty sure. He continues, when the High Court handed down its decision in the Bell case, the NHS immediately pulled down the shutters on healthcare for young trans people. When the Court of Appeal overturned that decision on multiple grounds, the NHS unaccountably left those shutters in place. Kemi Badenoch has explained that much of this happened because her government chose to prioritize ideology when it came to appointing key positions in health. The evidence shows the outcome was predictable and predicted, which was a huge increase in deaths of young trans people. There were whistleblowers who have personally, like Joe has personally spoken to 2 of them. I've seen their staff IDs and each has provided me with some internal Tavistock documents. There is no doubt they are who they say they are. Whistleblower 1 tells me that in the 7 years before the High Court decision, which was on the 1st of December 2020, there was 1 death of a young trans person on the waiting list, but in the 3 years afterwards, 16 deaths. So over the course of 7 years, there was 1 death of a young person waiting for this care. And after the Tavistock and Bell decision, 16 deaths over 3 years. Whistleblower 1 also says they raised these concerns with Dr. Cass? With Hillary Cass and the director of Tavistock. I've seen an email to both which sets out these death numbers. The email complains vigorously of the failure of both individuals to engage with these numbers or with the whistleblower. We put these points to the Tavistock and Dr. Cass. The Tavistock chose not to engage. Dr. Cass's team directed us to paragraph 5.65 of her report, which we can see in the following tweet. The review met with the Tavistock and Portman NHS Foundation Trust to discuss deaths of patients who had been referred to or were currently or previously under the care of GIDS. The patients who died by suicide between 2018 and 2023 were described as presenting with multiple comorbidities and or complex backgrounds. In addition, the trust observed that risk of suicidality was heightened at transition points in patient care, for example, between between child and adult services. The young people were more likely to be registered female at birth, identifying as male in adolescence. So it presents these deaths in a way that blurs the impact of the restrictions imposed by the NHS. Oh yeah, they're basically just saying, well, they had comorbidities. Like, well, you can't say it was our fault because they had other mental health issues. And like, we've gone over this before. Trans people have comorbid health issues, usually because they do not have access to care or they are not being affirmed socially. Mom has said like mourn. Okay, anyway. Oh yeah, well, those trans kids were just depressed anyway. That has nothing to do with us, apparently. Okay, cool. Just like completely brushing it off. Whistleblower 2 confirmed that they agree with the numbers on the presentation prepared by the named doctor for safeguarding, which were the numbers given above. Whistleblower 2 says that when staff working at the Tavistock planned an open letter, they were threatened with disciplinary proceedings and being reported to their regulatory bodies if that letter contained the death numbers. This is active suppression, a deliberate attempt to suppress these numbers. The minutes of Tavistock board meetings in that period, 2018 to 2023, in the 3 years to December 2020, I found reference to 1 death and apparent suicide. In quarter 3 of 2020/2021, there is further reference to a death, quote, likely to be suicide. In quarter 1 of 21/22, there is another suicide. Like, this is just more evidence. The minutes for January 22 contain a reference to 7 deaths, quote, in gender within that quarter, of which 2 or 3 are probably suicide. For the first time, no breakdown is given as to whether they are GIDS or GIDS or GICS. There is talk of an audit of suicides in the trans group. These figures also ignore attempted suicides, and they will not capture all deaths. Without explanation, the Tavistock has not published a number of board minutes, including those at the end of the period. They ignore that care for young trans people passed over to NHS Arden and this other unit in March 2023. These figures ignore As the paragraph from the CAS report acknowledges, a trigger for suicides is young people moving from the kids services to adult services. Those suicides will be captured in the adult services, but not the young services. So part of the reason why there's an issue there, I believe, as I understand it, is that if you're on the kids waiting list, you kind of have to start over on the adult waiting list when you turn 18. So if they keep pushing back your appointment and like not giving you the care when you're young, you turn 18. I mean, you're still young when you're 18, but when you're not a minor, you kind of have to start over, and the list just gets longer. Like there's more and more and more adults on the list. So, I mean, I don't know how, like, if you're like 50th in line on the kids list out of 500, do they put you 50th in line out of 1,000 on the adults list? Like, they don't probably put you at the very bottom, but they take into account the time you spent on the list. So if you're a kid who's been waiting 3 years and then you switch to adult care, you get bumped above people who've been on the adult list for a shorter period of time. I guess that's somewhat considerate. But there are more people on the adult list. Yeah. So even if you've been on the waiting list for 3 years, there are adults on the waiting list who've been on for longer, and there are more of them. So yeah, like, we have evidence that restricting access to this care worsens mental health outcomes. It causes deaths of children, and the NHS has been deliberately sweeping this under the rug, according to these whistleblowers who work for the NHS. Like, I don't know, like, how the UK government can claim to have any legitimacy on this, like, or in any subject, really. They are just like us, letting COVID rip, like, just serious failures of public health. And yeah, of course, the private clinic profits the longer the NHS list is. You're supposed to just be able to access specialist care on the service you already pay tax dollars for. But now it's also not legal for you to seek this care at a private clinic if you are under 18. Like, they will not let you do it, even though those are medical professionals who are doing their due diligence, making sure that you do actually need the care. Like why do we have a for-profit healthcare system? Like, you know, that's like supposed to be the benefit of the NHS, is that it's not a for-profit system. Everybody gets the care because everybody needs care. But nope, not if you're a trans youth. They will actively, I don't know if it's criminalized, but they will actively penalize people who are seeking this care. This is a scandal of massive proportion, and I basically only see trans people talking about it. I know that my friend Kat talked about it on her channel, Bridget Empire, and that video of hers did really well. Thankfully, a good number of, like, couple 10,000 people saw it. Like, yeah, this is extremely depressing. And, like, children don't deserve to be treated this way. If you want to say that you care about these kids, okay, well, you are causing them to harm themselves. Children, young adults, teenagers, they deserve access to care. They know who they are. And we put them through a rigorous process anyway, so that, only the ones that we're 100% sure need the blockers get the blockers in the first place. And then, of course, you were so rigorous in the testing before that basically 100% of the kids who start on blockers go on to cross-sex hormones. Like, blockers are not like a guarantee that people are going to go on cross-sex hormones. It's the fact that you only let the most stressed out kids get to have the blockers. Cisgender people placing themselves into a position of authority, telling trans people what's good for them, telling trans people when they get to start living their lives, telling you when you get to have surgery. None of the media covered the trans youth demonstrating for days. Yeah, and do I have that? Okay. Yeah, the trans youth were protesting, and I know that I have a link to that somewhere here. So yeah, trans youth, I don't know if they still are, but they were occupying NHS England Wellington House earlier this month in defiance of NHS bans on trans healthcare and politicians which use them as pawns. They put out a statement. Earlier this month, they were on their third day of occupying the front of NHS England headquarters. Like, of course, this is like at least the second time that there has been a huge demonstration of trans people like protesting the NHS, and the news has just refused to cover it. So their statement says, in the UK, we as young trans people don't have the right to access gender affirming care. We used to spend years on waiting lists for medical support, but now the doors are fully closed to new patients. The medical support we need is extremely time sensitive, and many of us die waiting. We are young people just like any others. We want to be treated with dignity, age alongside our peers, and move through the world as we are, not as others tell us we should be. And yet, our supportive parents have been threatened with child safeguarding referrals, our pharmacies have been forced to hold back our medications, and our schools have been made battlegrounds with us at the same time as weapon, aggressor, and victim. We refuse to live like this. We deserve better. Right, because Keir Starmer also said that he wants to basically reinstate Section 28 and have it be like, oh, you know, it used to be that you couldn't talk about gay or trans people in the schools. And he's like, oh, we shouldn't be talking about gender ideology. So like, okay, you just can't, you're like wanting to reinstate Section 28, but only for trans people. Only for trans stuff. I'm so proud of them, but I'm so heartbroken that they have to deal with this. Like, this should not be young people have to spend their time doing. They should be able to worry about having their first crush and like having, like, how am I going to do on the sports team and who am I going to ask to the dance? Like, we are robbing these people of their youth. Like, we are robbing young people of their experience as teenagers and young adults, and like forcing them to grow up and deal with these adult issues of politics and access to medical care and stuff like that. Like, it's wildly egregious. It's a huge scandal, sweeping this under the rug, selectively, you know, picking and choosing evidence for what? As like seemingly as part of a plan to eradicate trans people, because really the hope of these people is, well, if we don't let them get this healthcare until they're adults, maybe they'll just stop identifying as trans. You know, oh, most of them grow out of it anyway. That's conversion therapy. You're hoping that passive pressure will make them desist from identifying as trans. You are trying to make fewer trans people. That's why we say that this is part of a genocide. If you are trying to reduce numbers of the group by creating unlivable conditions for them or by means of coercion, that's genocide. And it's happening to more than just trans people, to be clear. There are other groups that are experiencing similar pressures: denial of access to medical care, unlivable conditions, conditions that create like poor mental health outcomes and suicide attempts. You know, it's not like trans people are the only ones, but trans people are directly in the sights right now. So I don't have anything else to say about this. I think it's horrible, obviously. I'm pissed. And it seems like the newly enacted Labour government is just going to continue this deeply conservative Tory policy. Last month was Pride, now it's time for Wrath. Thank you so much to my patrons, including Tiago Nascimento, Mersh Rolvog, Jack, Amanda B., Michelle Winter, Wellington Marcus, Danielle McDonald, DZXN, Spooky Heather Sylvia, Pasnell Infinity, Suzanne Maynard, Sojo, Jamie Jam, Desi Quiche, Jericho, Kevin Young, Liam Hodgson, Athiet, Elavie Nobody, Mr. Atheist, Elizabeth Bartell, Celeste, Nova, and Michelle Frattaroli.